Hello and welcome back to Newsroom Nigeria. This is really hard for me to say. It's hard to say these words, but we must have to just report the news. It's hard to say these words without a weight in my chest. We lost Sonto Chuku, Christelle Maduagu, also called Somi, a young promising anchor at Arise News. She was 20 years of age. She studied law. She had a clear voice, a bright future, a heart for justice and gender equality. The world was just starting to see what she could be. And then this tragedy struck. This is very, very sad, not just quite sad. Very, very. What we know so far is this. Somi's apartment in Katape, Abuja was broken into robbers. She apparently leaped from her building, not to end her life, but to escape danger. She survived the fall, but she didn't survive everything that came after. She and an aged security guard were taken to Maitama District General Hospital, but were allegedly denied treatment because hospital staff asked for identification before treating them. By the time whatever formalities were done, it was too late. This is not the first time that this kind of thing is happening in Abuja, the art center, the art beat of Nigeria, the capital of Nigeria. This is not the first time it is happening. Mind you, a while ago, a young lady survived a one chance incident and she was taken to an hospital right there in Abuja. And the same thing happened. She was rejected. She died in the car that she was brought in with to the hospital. She died in the car that fateful day. And the same thing is repeating itself right now. And if care is not taken, this is the incident that we are going to keep seeing is going to continue if the necessary changes are not being taken. It's just beyond sad. And the another concerning thing is if this were to not be an incident that has anything to do with a Rise television anchor, probably we wouldn't even be hearing about it. It wouldn't be getting the deserved or the desired news coverage that it needed. But because this is a news anchor for Arise Television, it's getting a wider coverage. And I began to realize that it seemed like people are now used to hearing news of tragedies every single day. That it's now it doesn't mean anything any longer to people. We have different insecurity incidents in the north, and a lot of news television or news media have stopped reporting them because it has now become the norm. It has now become as if it's now the regular occurrence. There is no news there, and for something to be news it has to be something strange that has never happened before. But because this is a news anchor, people do not vibes any longer. Nurses who are supposed to rush in and save, an innocent life, they no longer value it any longer. Just a few days ago, somebody was telling us a story of how the former governor of Ondo State, he's a doctor, he's a medical doctor. He was at a hospital in disguise and they did not know. And the nurse was telling somebody that, Nami give you belle, somebody that you're supposed to rush to rescue. You are telling her that Nami give you belle. It's just the reckless way in which healthcare practitioners carry out their duties in Nigeria. There is no urgency to save lives. I wonder why the hospital was asking for identification. I wonder why. This was not a robbery. This was not a gunshot wound. She did not have a wound. So why would they be asking? Because typically, hospitals would want to ask for identification when you have a gunshot wound. And, that has even been, I think that constitution or that law has been scratched since the girl that died who had a gunshot wound and was taken to Abuja hospital. Since that incident, I think another law has been passed that you don't need somebody to go and give you a police report before you can treat somebody with gunshot wound. Why they're asking for identification in this instance instead of trying to save this young girl's life is something that I can never understand. Moving on, let me walk you through some of the systemic failures of how Nigeria failed this young lady. First of all, The fact that armed robbers could invade a residence in Katape, presumably a relatively secure area, speaks to how unsafe many parts of Abuja have become. These aren't just poor neighborhoods, these are places where people should reasonably expect safety. The increase in armed robbery is well documented, but security apparatus, police patrol, intelligence seems unable to prevent these intrusions. When the robbery occurred, Somi jumped, which likely saved her from further immediate violence, but meant she suffered serious injury from the fall. There are reports she lost a lot of blood before help could adequately reach her. Delays in responding to emergencies can be deadly. Also, some reports say that even getting the hospital to engage required documentation. That time lost is time she didn't have. This is where much of the public anger is. Medical ethics, legal obligations, and basic humanity all demand that someone who arrives gravely injured be attended to immediately, regardless of whether they have ID or not. Yet the hospital allegedly refused to treat without identification. It seems that protocol and paperwork were prioritized over immediate care. Somi, though still alive, was rejected. That likely cost her her life. Beyond any one hospital, this is about how else infrastructure, regulation, emergency protocols, and accountability are handled in Nigeria. It's about how people are let down when their lives are valuable. It's about how rules that should protect life instead becomes obstacle to it. Now let's consider what might have made a difference. It could have made a difference, for one, if the hospital had accepted her immediately, putting aside demands for identification, no matter how inconvenient or how official the rules are. She may have had time, even seconds count in trauma care, to stop bleeding, stabilize, and do surgery. If emergency medical services like ambulance, paramedic had arrived earlier, or if someone had proper first aid, bleeding control, airway management could have improved our odds. Or, for example, if the Nigerian police had responded when the security guard had called on them, probably, according to Shore, probably if their car would not have been stolen, maybe the Nigerian police would have responded. But, here we are today. Moving on. If security measures had either prevented the break-in or made it less likely, strong locks, alarm systems, quicker police response, the initial trauma might have been avoided or reduced. If hospitals are better equipped, blood bank, trauma units, and staffing, and if training including responding swiftly without bureaucratic delays, the outcome might have been different. So, yes, many experts believe that some of the factors that contributed to her death were preventable, very, very preventable. It wasn't inevitable that she would die, given what happened, had the response been timely and compassionate. There are several levels at which the state, in the broad sense, failed. According to one of the few last posts that Somi made on social media, she said, "May Nigeria not fail me." But Nigeria, unfortunately, failed her. The government's most basic duty is to protect citizens from violence and harm, but through security, preventing crime, and through health systems, saving lives when harm occurs. In this case, both failed. There are laws and ethical codes requiring hospitals to treat emergent cases, regardless of ID and financial status. So why are these hospitals still asking for ID when the law clearly states that you don't need an ID to treat an injured person? Even in the case of gunshots, there is been another law saying that they should not ask for ID or police report, even treating a gunshot wound. And in this case, it wasn't even a gunshot wound. So why did they need the ID? If such laws exist, and they do, at least in principle and in regulation, they were violated. Exactly. I think that hospital should be sanctioned. They should. They shouldn't go unpunished. Apart from the armed robbers that invaded our apartment, the hospital, the nurses that was on duty, they should all be sanctioned, from top to bottom. Things should be different. We should not always come online, or always talk about these failures of a system, of the economy, of a government. These are preventable failures. These are things that shouldn't even cost a human alive. This is a country where paperwork requirements and formalities is given priority more than the life of a human being. Can you imagine that? Formalities, paperwork, all of that is more actually saving a life. So what are you a doctor for? What are you a nurse for? Why are there hospitals when you cannot even come to the aid of somebody, somebody you see that this person is apparently injured. The priority should be saving a life, not paperwork, not formalities. This formality caused delay that took the life of this innocent girl. It's very sad. If hospital staff are refused treatment, or if emergency services are slow, who is held responsible? What redress do victims' families have? The outrage around Sommie's case shows that many believe accountability is lacking. The cost is tragic and personal: a young life lost, a family in grief, colleagues, friends, public dismay, but also public trust is eroded. People lose faith in security, in healthcare, in government. There are broader implications to this. A journalist, someone used to telling stories. It's quite sad and quite ironic that now a story is being told, not in a positive light, not in a good way, that you would want your story to be told. A story is told in absence. A story is told in such a sad way. I watched Arise television yesterday, and I saw Ojiope, their Rise television anchor. She was uncontrollably crying. She just managed to, keep a straight face, just to pull through, because it's her job, of course, and she has to carry on. But you could see it written all over her face. This shouldn't have happened. It shouldn't. Moving on. There needs to be clearer enforced rules. Emergency or trauma cases are attended to immediately with immediate effect. Better prevention of armed robbery and faster emergency dispatch. The story reminds us of what happens when rules become more sacred than life. Very sad. Legally require hospitals to treat patients. These are what we need to see moving forward. These are the things that Nigerians want to see. We want to see that hospitals are legally required to treat patients in life-threatening situations, no matter what, without asking for documents, without asking for identification. Trauma response units, ambulance services, or first responders properly equipped and widely available. Investigations into hospital negligence, sanctioning of staff and management of policies violated, transparency in findings, better policing, safer response times, possibly reforms in estate security, armed forces supporting civilian security in urban context. If people know their rights, for example, that in emergencies, hospitals should treat first, they can challenge the proper deniers of care. From paperwork first to life first. That is what we want to see, and as Nigerians. Finally, Somi Maduogo's death is more than a heartbreaking loss of one bright young life. It is a mirror held up to the many cracks in Nigerian system. In the cascade of failures, from security to medical response, we see how multiple small gaps can join to produce a fatal outcome. It's not enough to say we are sorry. We must ask, what have we done to prevent this from happening again? Nigeria holds Somi better. Our deaths should lead to reform in hospitals, in policy, in culture, because if we don't change, someone else, someone just like her, will suffer the same fate. Let's have your thoughts and your opinions in the comment section below. So please watch the Arise television, visit Somi's parents and OGOP and our crew members analyzed what happened to Somi. Bye for now, guys. I'll see you in my other video.
Today, the Arise News family mourns the tragic loss of our beloved colleague, news anchor, reporter and producer, Somtochukwu Christelle Maduagu, affectionately known as Somi, who was taken away from us far too soon at the age of 29.
Hello to our viewers in the US and around the world. I am Somi Maduagu, coming
on September 26, 1995, Somi tragically passed away in the early hours of Monday, September 29, 2025, following an armed robbery incident at her residence in Katankwe area of Abuja. The Nigerian police are currently investigating this heartbreaking crime. Somi was not just a cherished member of the Arise family. She was a vibrant voice that engaged and connected with viewers across the nation. Her presence on our screens brought warmth, professionalism, and authenticity that resonated with audiences. But beyond the airways, beyond the cameras, and the studio lights, Somi was a trained lawyer, a dedicated professional, a supportive colleague, and a beauty queen. In September 2023, Somi represented Nigeria at the 40th Miss Tourism World in China. Ahead of the pageant, she spoke exclusively with Arise News about her aspiration to become a politician.
by birth, I don't have an option about the kind of woman that I want to be. I'm the first daughter of my parents, so right out of the womb, I'm a born leader, and so that's kind of at the top of my mind in any decision that I'm making. On a bigger picture, I want to be a politician. Like you mentioned, I'm from Anambra State, I'm from Anambra Central, and I'm very interested in politics. I'm very interested in impacting my state and Nigeria in general. And I moved to London at the end of my National Youth Service program, you know, like everyone does, just jackpot, trying to make some money. And I just felt very unfulfilled. I was making more money than I ever would in Nigeria, but I just felt very unfulfilled. So the kind of woman I want to be is definitely having positive impact in Nigeria. She's definitely taking up space. She's definitely not just talking about increasing female participation in politics. She's actually doing something to make that happen. And she's graceful, she's feminine, she's gorgeous, and she's fashionable.
What a beautiful soul. At just 29 years old, Somi had already made an indelible mark impacting society, but she had so much more to give. So much more stories to tell, and so many more lives to touch. Today, we extend our deepest condolences to Somi's parents, siblings, extended family, friends, and loved ones during this incredibly difficult time. Her voice may now be silent, but her spirit, passion, and legacy will endure as part of our collective memory here at Arise News. We remain in shock and call for a speedy investigation, apprehension, and prosecution of those responsible for this senseless crime. As the Arise News family says goodbye to Somi, we honor her memory by continuing the work she loved and by demanding justice for this tragic loss. Rest in peace, Somi. Your legacy lives on in every broadcast, every story, and every heart you touched. Tributes have been pouring in. I'd like for you to help me read this.
All right, so the Minister of Women Affairs, Hajia Iman Sulaiman Ibrahim, on Monday expressed deep sorrow over the tragic death of Somtochukwu, describing her death as a painful and devastating loss, not only to her family and colleagues, but also to the entire media industry and all those whose lives she touched. She wrote, "Such a bright candle has been blown out in her prime. Nigeria has lost a young woman of talent, courage, and promise. On behalf of the Ministry of Women Affairs, I extend our heartfelt condolences to her family, colleagues, and the entire Arise News family. May her gentle soul rest in perfect peace." Minister of Women Affairs, Hajia Iman Sulaiman Ibrahim.
Well, the Minister of Information and National Orientation, Mohammed Idris, described Sommie's death as regrettable and a grievous loss. In a letter of condolence addressed to the chairman of the Arise News channel, Chief Nduka Obaigbena, Idris wrote, "I write to convey our deepest condolences to you and the entire Arise News family on the shocking and untimely death of your esteemed anchor, Ms. Somtochukwu Christelle Maduagu, who by every account was a vibrant and a dedicated news anchor, consummate lawyer, and a model of professionalism whose work resonated with audiences across Nigeria and beyond. Ms. Somtochukwu's tragic death is a grievous loss, not only to the Arise News family, but to the Nigerian media fraternity, and indeed, the nation." More tributes poured in. The governor of Enugu State wrote, "I received with shock and a deep sense of loss the news of Somtochukwu's tragic death. This is highly condemnable. It is reprehensible and cowardly. At 29, she had already established herself in the nation's media space. She was a consummate professional and lit millions of screens with her superb delivery. Indeed, a shining light has been extinguished too soon. A budding superstar has been cut down. And I call on the security agencies to do everything within their powers to track down her killers and bring them to book." The governor of Kaduna State also sent his condolence. He wrote to Prince Nduka Obaigbena, chairman of Arise News and This Day Group, and the entire management and staff, "I extend my deepest condolences. May you find strength in knowing that Somi's legacy of excellence and integrity endures to her grieving parents, siblings, and loved ones. No parent should bury their child. My thoughts and prayers are with you. May you be comforted by her beautiful memories and indelible mark she left on all who knew her." More tributes. Ayo, can you help me with this?
Yes, we have one from the Minister of Aviation and Aerospace Development, Festus Keyamo, who wrote, "On behalf of the Ministry of Aviation and Aerospace Development, my family and myself, we offer our sincere condolences to the families of Somtochukwu Christelle Maduagu and the management and staff of Arise News Channel for this tragic loss. May God Almighty comfort you all at this difficult time."
The FCT Police Command also described the incident as a cruel and senseless act. The Commissioner of Police, Ajao Adewale, assured the FCT Command remains fully committed to ensuring that justice is served and ordered a discreet and comprehensive investigation into the circumstances surrounding the incident. Well, in one of her last tweets back in August, Somi wrote on X, "I pray from the depth of my heart that Nigeria never happens to me or anyone I care about." Dr. Bati, this tweet has since garnered over 1 million views. When I heard the story yesterday, my heart broke because, like she stated, Nigeria happened to her. I reached out to our correspondent in Abuja, who detailed the circumstances surrounding her death. She jumped down from her home when she heard about 14 armed robbers came to her home. And she did not die on the spot, Dr. Bati. She went to the hospital and she was rejected. And I'll tell you the name of that hospital. If you can continue with your thoughts, I'll bring out the name of that hospital, because this really is a tragic, tragic incident. Sommie's life could have been saved, but the hospital rejected her. Dr. Bati, go ahead. Let me get the hospital.
Okay, this is heartbreaking, as you have said. This is sad. This is horrific. That lives will be lost in a country where there is a government and where the responsibility of government is to save lives and property. And yet, on a daily basis, we keep hearing these stories about Nigeria happening to persons. If people are not killed due to bandits attacks, insurgents attacks, terrorist attacks, they are killed even by circumstances of just being Nigerian. And that's why repeatedly we have said on this table that Nigeria happens to people. When Nigeria happens to you, we are left sitting here and paying condolences, expressing our regrets, condolences to families, to persons involved. This one has struck home here, and that's why we are all in black, mourning our colleague. It's very sad, it's very unfortunate, but it should be a subtle reminder that the Nigerian government still has a huge task to ensure that every Nigerian can feel safe in this environment. Anybody who comes into this territory called Nigeria can sleep at home. How can somebody be in a home and then armed robbers will go there? We used to say that armed robbery had been eliminated by 419, by petty crimes, by e-fraud, but to see that armed robbers are still actively at work and that Nigeria is returning to the days of Anini and fallen on shore is a very sad development indeed. And I think that President Tinubu should not just take this seriously. He should say, in this particular case, that the authorities, the agencies, should carry out investigations and ensure justice for Somi. Not because she's one of us, but because every Nigerian life matters.
Yes.
Whether you are a journalist or you are a cleaner, whoever you are, you have the right to the dignity of life. You have the right to life. And it's the job of government to make sure that we are all safe. We are all saddened and we commiserate with the family, but a life of so much promise, of so much hope, a beauty queen robbed of the promise of the future. The story is about Nigeria, and it's an unfortunate story.
She was taken to
Second,
the Maitama General Hospital.
The story you raised about the hospital.
Yes, it's called the Maitama General Hospital.
Maitama General Hospital. Now, there have been various versions. There are some people who have said, oh, even the security guard died. Why are we just talking about Arise and Co? No, whether it's the security guard or it's Arise family, nobody should die needlessly. Nigeria should not happen to anybody negatively. And then we make the point, we reiterate it, that hospitals, midwives, nurses, doctors, everybody working within that medical space, their primary responsibility is to save lives, beyond even the call of duty. Right. And I think part of the investigation should include the behavior, the attitude, the response of the medical personnel at that Maitama General Hospital. Is there a case of negligence? Could lives have been saved if they responded more professionally? These are questions that should be raised. Number three, the investigators, the security agencies, should not rule out any option. All of us have said, oh, the initial report we were given is that this was an armed robbery incident. Could there be other reasons behind this matter? Could this be an assassination? Could this be a case of occupational hazard? But we are saddened because there is no remediation. Life is lost. Hope Hope has been destroyed. And we are all here mourning as a family.
Absolutely. Life is lost. Ayo. Ferdinand Duohans, the correspondent I reached out, who's done a beautiful report on Somi as well. He said that, you know, the security guard, which you also mentioned, and alongside Somi were wheeled. They were not in a stretcher. They were wheeled into the hospital, and they weren't given any treatment because of lack of identification. And by the time the person who had the identification came by to the hospital, Somi was already taken to the morgue without any sort of communication.
Very, very heavy morning. It's been difficult for a number of people to even get through their jobs this morning as a result of the very sad story, sad incident that happened in Abuja. This apartment or this block of flats where Somi lived is in Kantampe, which is an affluent area in Abuja, close to Maitama and these areas, and meant to be relatively safe. And as you said, Dr. Abati, what we'd assumed was that the issue of armed robbery, killings like this, are things of the past that we don't see again in the modern Nigeria of today. But now we are seeing resurrection of old things that ought to have passed away. And we see the cost of this in terms of the human life that has been cut short in her prime. Now, talking about the healthcare service, so security failed Somi. Nigeria happened to her. And Barnabas, by the way, who was the security guard, and is said to have a young family and a child. So that's another young person cut off in their prime. They were taken after the armed robbers came. By the way, OG, the armed robbers came to this building, block of flats, over 10 of them, numbering 15. It shows that the temerity that they had the audacity, even though they were not afraid of the police, that 15 of them stormed a block of flats and rained terror for a considerable amount of time, and security officials, the police did not come at any point during the operation. That speaks a lot to the breakdown of security in the state's capital, in the capital of Nigeria. Then beyond that, the security architecture failed. The healthcare system, which is supposed to be an opportunity for people in an emergency, such as Somi found herself, to receive urgent care. In other climes, in other places where healthcare works, this is where they would be urgently attended to. In the past, we used to have situations whereby if you had a gunshot wound or accident victim, they would ask for certain things because the hospital wanted to indemnify themselves from any police issue. But this has been done away with. There's a law to remove that, so that anyone who was injured by any reason whatsoever would first of all receive care, and other things would follow. The hospital failed Somi in this regard. And I'm calling on the Mandate Secretary for Health and Environmental Science in the FCT, Dr. Dolapo Fashawe, to look into this matter, especially with hospitals. It was on this same table we discussed the hospital in Abuja, who couldn't very well take care of a pregnant woman. So we have incidents like this whereby there's negligence, gross negligence, that costs human life. Somi was a promising star, like you've mentioned. Somi was not just a TV presenter anchor, she was a lawyer. She stood up for the rights of women. We talked about how she was, very instrumental to pushing forward the reserve bill to allow more women in the National Assembly. Somi was also entrepreneurial. If you read, I read one of her interviews yesterday where she talked about the influence her parents had on her, Mr. and Mrs. Maduagu, who gave her wings to fly and encouraged her to pursue her dreams. Her younger ones, Osi and Divine, her brother and sister, who are now left without their Ada in the person of Somi Maduagu. It's a very sad situation. No parents, like one of the people who had sent in their condolences, ought to face burying their child. It is sad, and too many parents in Nigeria have had to go through this sad loss because of the failing of government and the incompetencies of what we should have as government infrastructure. So I hope that the legacy, or at least the learning from this death, one too many, would be that we would look into security in Nigeria,